Hello and welcome to Wellness Wednesday. I'm James Curry with the Communications Department. I'm talking to Courtney Yawn with the Maternal and Child Health Program here on Wellness Wednesday. Good morning.
Good morning.
Courtney, you've been with the Health Department for a little while, haven't you?
Yeah, a little over a year and a half.
Okay. I know you've been in a few different programs, so you're pretty familiar with some of the other avenues, areas the health department has to offer. But let's talk about the program that you're with, the maternal and child health program. So tell me a little bit about that program.
Okay. So I'm a public health social worker. I do work at the teen center in the maternal and child health department. I'm working closely with the Parents as Teachers program, which I know they've been on Wellness Wednesday. I also work closely with Fatherhood Initiative. Um, Basically, my job is to give resources to patients and participants in the community. I refer a lot of people to our programs at the health department because we have so many programs that the community is unaware of.
Yeah, you touched on it. Yeah, we had some other programs that were with the parents and teachers on previously, and
Hmm.
there's a lot of different programs and a lot of different resources out there. And we thank you for being on here to kind of explain there. I mean, there's a lot of resources out there for new parents, young parents, people just seeking information. But now October is special for your program. So can you tell me why October is special for this program?
Sure. In maternal and child health, we do a lot of education as well. And part of that is safe sleep. And this month is SIDS Awareness Month. So we are trying to highlight SIDS awareness and try to encourage people to use safe sleep practices to decrease the amount of SIDS cases that we have.
And SIDS, of course, is sudden infant death syndrome.
Yes.
And there's been a lot of studies on SIDS, and a lot of that stuff, um, some of it, well, let's say a lot of it is education, and the self safe to sleep program is education. I know
Mm-hmm.
one of their main points is back to sleep,
Mm-hmm.
and especially the way that you position the baby when it's time to go to sleep. So, um, if you're a new parent, you don't know these. You're not born knowing these things, so it's helpful, to be able to have these resources to help teach a young parent. Let me look on my notes here for just one second. Um, so tell me a little bit about some of the risk factors for SIDS.
Studies have shown that a lot of the reasons that SIDS occurs is because of unsafe sleep situations. It's often referred to as crib death because it does happen a lot of times when the baby is sleeping. So we like to remember the ABCs of safe sleep, which is the baby needs to be sleeping alone. We encourage room sharing, not bed sharing. And B is for the back, like you had said. Baby needs to sleep on their back. Once they reach an age where they can turn over, then they should be strong enough to support themselves and sleep safely. But at least for the first year, you want to try to lay the baby on their back. And C is for crib. The baby needs to sleep in a safe crib with a firm um, sleep surface, like a firm mattress, in a crib or a cribette, a portable crib, pack and play.
Yeah, I do remember some materials from that program. No extra things in the sleeping area. No toys, no
Right. No
pillows, things.
blankets or pillows. Right.
Right. So those are things to be mindful of also too. And co-sleeping, I think you talked about that too. Alone, um, who doesn't want to lay there next to their child? But um, you run the risk of maybe falling asleep or taking a nap, and you know you make a lot of involuntary movements when you sleep, and you wouldn't want to hurt the child. So Yeah, the ABCs are very, very important, and thank you for bringing those up. Um, Now, we talked a little bit about some aspects of the program. So tell me how people find out about the program. There's referrals from some of our other programs, or what?
Correct. So, a lot of what I do, like I said, is working at the teen center. We have a lot of participants already through Parents as Teachers and Fatherhood Initiative. I will be going to some of the Fatherhood Initiative classes this month and showing them some safe sleep videos designated for fathers specifically. And any other programs throughout the health department, I can be contacted to assist. I work closely also with the Women's Center. I've gone over there and given them information, and they've contacted me to come and talk with patients there. So anyone is welcome to call me. I can come. I will be visiting the different clinics and handing out information regarding safe sleep. So everyone within the agency should have my contact information.
All right, well, give your phone number right now so we make sure that everybody has a way to contact you.
Okay, it's 544-2080.
Okay, 251-544-2080.
Yes.
Okay. Um, we are also going to be including a link with this video with some other tools and resources that you provided for us. Um, we've had to kind of readjust a lot of things because of COVID. I know normally you would have gone out to do a presentation, so you've been kind of limited. Is it a possibility that somebody could Zoom or video conference with you or anything like that?
Definitely, yes. I'm open to helping in any way I can, not just through the health department, but in the community.
Okay. Well, good. So it's good for people to know that, you know, yes, COVID is going on and there's a lot of challenges and limitations, but we'll be able to use technology to overcome those to get this message out because it's very important. But Courtney, thank you for being on Wellness Wednesday. Is there anything else you'd like to add about the maternal and child health program?
Only that it goes way beyond just SIDS awareness and safe sleep. We also want to educate on car seat safety, anything we can do to help keep the mothers and children in our community safe and healthy. Also, there is a hashtag that we're using this month. If you want to take a picture of your baby sleeping or in a safe sleep area, you can do hashtag snap, safe sleep snap.
Yeah, car seat safety. I'm glad you touched on that. We'll talk about that real brief here, but they do expire. They have expiration
Yes.
dates on them. So, and that's very important because they're made of materials that they degrade. Most of those materials, like the car seat, sits in a car when you're not using it with the baby, and the interior of the car gets hot, makes those materials degrade, makes them unsafe. So that's why they have expiration dates so that they can be replaced. Especially if you get something secondhand or borrowed or handed down, you want to make sure that you look at the expiration date to make sure that it's still safe. And I know if somebody has a question, is this car seat safe? They can get in touch with you, or they can get in touch with the police department or the fire department,
Mm-hmm.
and there's several different resources to be able to help that parent determine is that car seat safe. But Courtney, thank you for your time and thank you for giving a little highlight on the program. And have a good Wellness Wednesday.
Thank you.